Yes, sir.
Yes, yes. Can you read this one?
A 42-year-old man was riding a motorcycle and following a road traffic accident. He was thrown off the bike and injured his back and neck. He was given immediate first aid and basic investigations, including CT scan of the cervical spine and head, which were normal. He was in pain, especially in the left upper limb initially. He was discharged from the accident and emergency department. He continued to have pain and noticed the weakness of the hand. He presented 1 week later with global muscle wasting of the left hand. Which one of the nerve or the nerve roots most likely will be involved? So the option are C7 median nerve, radial nerve, T1 nerve root, and fifth is ulnar nerve. So he basically met an accident and he was in pain and he was discharged from the accident and he continued to have pain and noticed weakness of the hand. He presented 1 week later with global muscle wasting of the left hand. Okay. Forearm and arms are spared. Am I right, sir? Uh, hello?
Yes, yes, yes. See, forearm and arm is basically spared. Okay.
Yes, sir. Yes, sir.
It's only
So
the hands which are involved.
yes, sir. So basically, options are first is C7 nerve root, second is median nerve, third is radial nerve, fourth is T1 nerve, fifth is ulnar nerve. So basically, ulnar, median, and nerve root would have specific areas and not entire hand, sir. So
Yes, very good.
basically, the option is definitely not B, C, and E, and definitely not D because T1 is
Okay.
thoracic area. So a
Okay.
single option is left as C1 nerve root.
C1,
Option A.
C7.
C7, sorry, C7. Yes,
C7. Okay.
C7.
So, what is the brachial plexus? Start from which nerve root? Brachial plexus.
C5, C6, mostly.
Yeah, it starts from C5 to T1. Okay, brachial
Yes,
plexus
yes,
C5 to T1. Okay, so
yes, sir.
C7 is mainly important for movement around the elbow. Okay, whereas
Okay, sir.
C8 and T1 is for the hand. Okay,
Okay, okay,
okay. So T2 is in the chest. Okay, what you mentioned was
okay,
T2
okay.
is in the chest.
Sorry, sir.
So in that scenario, what is the revised answer for you?
T1, sir, T1.
T1, T1.
Mhm.
Okay. So the
Yes,
most
yes,
important clue there was global muscle wasting. Okay. So that you
yes, sir.
don't get in ulnar, radial, or the
Median, sir.
median nerve palsy. Okay. Just remember C7 is the movement around the shoulder and the elbow. Okay. Whereas the
Okay, sir.
T1, C8, T1 is around the hand. Okay. So have
Got
you
it, sir.
heard of this syndrome called as a Pancoast syndrome? Pancoast?
Yes, sir, yes,
Or
sir.
Pancoast
Improvement
tumor, where there is
syndrome.
a malignancy of the apex of the lung infiltrating the brachial plexus. Okay, so it can
Yes,
involve
sir.
the C8T1 nerve root, and patient can come with the wasting of the hand. Okay,
Got it, got it.
so we'll quickly go to the next question. Dr. Tania, are you there? Yeah, I think Dr. Dharamveer, can you read this one?
Yes, sir. Yes, sir.
Yes, yes.
A 20-year-old woman presents to emergency department with a decreased level of consciousness. She had a severe headache before being found unconscious by her friend. She was
Actually,
being
sir, I interrupt you. I just reached by 3 minutes. Actually, I am driving. That's why not able to answer and
No,
unmute
no problem.
myself.
I think let
Just
Dharamveer
2
take a
minutes.
few, a few questions, then you can take later.
Yeah, yeah. Sorry,
Okay.
sir.
Okay.
okay. It's okay. 20-year-old came to emergency department with decreased level of consciousness. She had a severe headache before being found unconscious by her friend. She has been complaining of generalized headaches, forgetfulness, and dizziness for the last few days. Her heart rate is 98, blood pressure is little low, 99 by 64. Respiratory rate is 24 breaths per minute, and oxygen saturation is 100% on 15 liters via non-breathing mask. Examination of her retinas demonstrated Roth spots. Okay. Which of the following is the most likely underlying cause? So, first option is carbon monoxide poisoning. Second option is glioblastoma. Third option is herpes simplex encephalitis. Fourth is subacute bacterial endocarditis. Fifth is subarachnoid hemorrhage. So basically, she has been unconscious and sorry, decreased level of conscious and had severe headache. And Roth spots is one finding. So if I'm not wrong, sir, Kindly correct me, sir, if I fumble.
Yeah, yeah, no problem.
We seen the bacterial endocarditis, like in the retinas.
Okay.
The rough spots, if I'm not wrong.
Yes,
So I'll
yes.
go option by option, sir. Carbon monoxide poisoning, less likely.
Okay.
And the thing is that there were no she was not in a. But it could be, sir. I'm so sorry, sir. It could be one of the thing. I'm
Okay.
not going into that. And glioblastoma, I do not know, but being a tumor, less likely at such a young age.
Okay.
Herpes simplex again should have having fever or some other um, signs of meningeal irritation, something like that.
Yes.
And subarachnoid hemorrhage, the headache could be the one of the things, but subarachnoid hemorrhage are something which is a worse kind of headache, not like the severe headache which have been she reporting,
Okay.
uh, because she has been complaining of generalized headaches. So that cannot be in the subarachnoid hemorrhage. Subarachnoid hemorrhage is, but sir, I'm so sorry. She had a severe headache also. So
Yes.
subarachnoid hemorrhage could be also an option.
Option. Okay.
Sir, amongst all the option, I would like to point on the two things, sir. Either it could be subarachnoid bacterial endocarditis or it could be subarachnoid hemorrhage.
Okay. You want to go with the D and E, correct? D or
Yes, sir,
E?
but the only
D.
thing is that the respiratory rate is so high
Yes.
and oxygen saturation 100% on 15 liters. That means she's
Yeah.
needing a lot of oxygen.
Yeah. She's hypoxic. Do you think one of those causes hypoxia?
No, sir, no, not at all.
Not at all.
Sir,
That's
I
right.
would like to go with A, sir. Carbon monoxide poisoning.
Yes.
Final,
Okay.
sir.
Yes. Yes. So this young lady who's come with decreased level of consciousness. Okay. So she
Yes,
has
sir.
history going on for last 2 3 days. It's not sudden onset because if you look at the history, she had some headache, forgetfulness, some dizziness for a few days, then severe headache. Okay. So something is going
Okay.
on for last 2 3 days. Okay. And she's
Okay.
BP is lower side. She's tachypneic. Saturation is hypoxic. Okay. So it's the respiratory involvement as well. Okay, so it's
Yes, sir. Yes, sir.
unlikely in glioblastoma or encephalitis because if these are primary CNS pathologies, glioblastoma, encephalitis, or
Yes, sir.
subarachnoid hemorrhage, they wouldn't cause hypoxia as such, isn't it? Okay,
Yes, sir. Yes,
unless
sir.
the patient is very drowsy and or in that they would have been intubated. Okay,
Yes, sir.
so that is unlikely. So, and if it's endocarditis, there are no signs of endocarditis there, either murmur or some rashes. Nothing is there. It's not a drug abuser. Usually there'll be a risk factor like drug abuser or recently underwent wall replacement. So we don't have such history there. Okay.
Yes,
So
sir.
considering all this, probably carbon monoxide poisoning. Usually, if it's a carbon monoxide poisoning, they would give that patient is in like recently moved to an house or some construction going on
Yes,
in
sir.
the
Close
house or
house.
some
Yeah.
gas geyser is there something they would have there. Okay, so those clues
Yes.
are not there, but definitely it is not fitting into B, C, D, and E. There are